Are you going?
What is the number one KPI of all dentisting humans? Is it, as my friend Mark Costas would say, EBITDA, or the number of bicep curls you can do? No, it is not that. That is an important stat. But the number one KPI of all dentists is how many times you feel like crying inside a day. We're dentists, and we have to keep our crying on the inside. But you are in luck. On this episode of Talking Nachos, we have amazing resources and sponsors that are going to help you cry less inside. I also want to share that we have our Dr. Jason Smithson event coming up soon. So just text Smithson to 215-543-6454, and we will send you back the best price possible to be part of our amazing Dr. Jason Smithson event. I'm ready for my first guest when my team is ready to bring them up. And I have Ryan from Kettenbach. Ryan, share what you do in this wild and wacky dentisting world to help dentists cry less inside.
Sure, Paul. Thank you for having me. So I think a couple of things. Number one, everything that we do, our motto is simply intelligent. Okay, so what that means is that our innovations are really designed to help the dentist not only simplify their process, but also minimize their inventories. At the same time, we are a direct selling manufacturer. So we manufacture all of our own technology, which consists of elastomers, resin restorative materials, and now a new preventive product, which I hope I get to talk about in a second. But basically, the way that we help simplify process and reduce inventory is each material that we design has the clinician in mind and trying to give them something that a competitor product in the market can't or can't accomplish. For example, our new resin composites. So a nano hybrid composite system. Basically, we've designed this system with a chameleon effect, meaning that it only takes 5 shades of this composite, both a packable and a flowable material, to achieve all 16 classic Vita shades. So instead of having to inventory 15 or 20 different shades of composite, you only need 5 to do that. So it's cutting down on things that are probably going to expire. And by the way, we sell direct, like I said, so we're able to save the clinician 20 to 30% on
saving money. Studies show 114% of dentists like to save money. Their crown preps, Ryan, $2,000 works of art. They don't want any discounts on that. But you guys have been amazing sponsors for years. I love your product, Silginat. Just say no to alginate. Friends do not let friends use alginate. But you do so many different things. We heard about your composite, but fluoride. What could be new with fluoride? It's been around forever, but there's something new with fluoride. Tell us about that.
There is. Thanks for asking. So what we've done is we've developed a new fluoride varnish that's a gel, and it's made from dimethicone, which is a silicone material, instead of using ethyl alcohol and rosin. So with the ethyl alcohol, you get the stinging and the burning of the soft tissue and the tongue. With the rosin, you get that sticky, tacky, heavy feel on the teeth. And those two, and by the way, rosin's made from tree nuts, so it carries with it a potential allergen. Ours is completely hypoallergenic, leaves the patient actually with the sensation of a nice, smooth, clean mouthfeel, very respectful of the prophy that the hygienist had just done, but really improves the patient experience. And because of that, is likely to improve patient acceptance of the varnish treatment.
I love that. Start calling it the golden doodle of fluorides, because golden doodles are supposed to be hyperallergenic. I know there's no such thing as a totally hypoallergenic dog, but I think you should hear that. So Kettenbach, you guys have something that dentists also love. Through the power of dental nachos, dentists can get the best price possible by texting buying to 215-543-6454. So if this is the first time people have heard of Kettenbach or the 70th time and they want to save, why have you given us such special pricing? Just because I'm so special, like my grandmother would say?
Well, it's all the value. I mean, that you bring to us and the organization does. I mean, there's so many people out there that that we're able to engage with because of Dental Nachos, and in return, we want to pay that forward with special pricing. And by the way, anything that a dentist tries from us, whether they've used it before or it's a brand new experience for them, we offer a 30-day complete money back guarantee.
Awesome.
So there's no risk at all in trying a new product from us. And I want to stress that you're not going to find our materials through the distributors, Patterson Shine, for example. We've got local reps. If you go to Kettenbach's website and go to the contact us area, you're able to find your local rep and their contact information there.
And to make sure to ask for the Nacho sponsored deal, Ryan, I want to thank you for so many things. We talked about your composite, talked about fluoride. We use your impression materials, and of course, Silginat. Silginat has helped me cry less inside many times. Alginate to me is the most annoying dental material on earth. And I'll get some hate from my dentist. I don't care. I'm standing up for Silginat and not using alginate in your practice, as well as your fluoride and composites. Thank you so much for supporting all we do here at Dental Nachos, Ryan. Truly appreciate it. We see you at our in-person events. You support us online, and it means so much to us.
I appreciate it. Glad to be a part of it.
Awesome, Ryan. Great job.
Thank you.
So as you can see, first guest on Talking Nachos, decrease your cry inside feeling with getting materials at an awesome price that will make your dentisting life better. I am ready for my next guest, so my team is ready to bring up. Share with us here, even though I know my guests well, who you are and what you help dentists do to cry less inside.
I am Dr. Laura Brenner. Thanks for having me, Paul. And so, it's best shared with a little bit of my story.
Sure.
I practiced dentistry for 10 years, and 3 years in, I was absolutely miserable. I was so burnt out. I thought I hated dentistry. And this was in 2004.
Like this going to work? This is what you felt like on the inside?
Well, let's say crying on the outside a lot, not just on the inside. But no one was talking about this at all. We didn't have social media. It was 2004. No one was talking about burnout. I didn't know what was going on. And ultimately, I was on an island and I had to quit dentistry. I quit practicing after 10 years and just became really passionate about increasing the awareness that we all can define success differently in dentistry. So years after leaving clinical dentistry and completely changing careers and doing side gigs, I came back in as a career coach. And so now I help other dentists design their careers on their terms and possibly even practice less or not at all by doing
I love that,
else.
Laura. I want to share that. We always talk about customizing treatment plans for patients, right? And it is not a one size fits all. Whenever I post something on Nachos, it depends. What was the patient's third grade teacher's name? What's their medical history? Dentists love a lot of details. Yet when we talk about dentistry, it's not a one size fits all career. Tell us a little bit about, dentist, just because you feel burnout, it doesn't mean you have to quit dentistry tomorrow. Is that an accurate statement?
And I love that you say that, because I want to always make it clear that I'm not here to get people to quit dentistry. I'm here to get people to do what they want.
Yeah. I love that. I always say people's happiness level in dentistry is often dosage dependent, right? Dosage dependent. I mean, my good friend Brandon Hill, I don't think he could take watching the Eagles 52 weeks a year. He can only take that dosage of the Eagles. It would be way too much. And some people practicing 2 days a week is their happiness level for dentistry. Some is 4 days a week, and some can be none at all. Tell us, you get to talk to dentists on the front lines of stress. And is there any client or person that comes to mind where you're able to help them kind of transform their happiness level, treatment plan, more success for them that you could share with our audience?
Absolutely. And I love talking about my client, Jenna, because she really has followed the blueprint that I've created for people, and it's working for her. So she came to me unhappy in practice. She was working 4 days a week. She wanted to do something else, but she didn't know what. And so what we did was we have so many rules that we create as dentists that we think we have to follow about life and about dentistry.
Right.
And those are based on our beliefs and limiting beliefs. And so we worked on her beliefs first and helped her get into the mindset where she could see that she could do something else. So then she gave herself permission. And then the second step was helping her connect with what she likes and what's important to her, because we go on autopilot, right? We just forget who we are after a while by being the good little, boys and girls that everyone else tells us to be in life. So she decided that she loved painting, but she had this belief that you can't make money painting. So I said to her, well, someone's making money painting.
Right.
Let's look at how people are doing that. So we did a brainstorm. We came up with something that was interesting to her, which is those painting and sipping of places. And through a process of research and breaking that down into small baby steps so that every step is doable, because we talk ourselves out of side
Yeah,
gigs
for sure.
if it's too daunting. So we broke it down into steps. And ultimately, we evolved this program for her where she is doing these painting workshops that might involve wine, might
Yeah.
not. It just
Anything you add wine sipping to, memorizing the Krebs cycle and sipping, it really is a great branding technique, right? You want to memorize the
totally,
Krebs cycle? No, there's wine involved. I'm in. So yeah.
absolutely.
So
Yeah. And so,
what she adds to it is the fun. I actually went to a candle making and wax and wine with Daphne, and it makes an activity. It adds fun to something that you might not think of doing to treat yourself, right? So my team's done those painting activities. So is this what she's doing as her side gig?
yeah. So these are like workshops, like team building workshops that she's now developed continuing education for. So dental teams can go do their fun activity together, get CE, paint and drink wine, and learn. And no one's as far as I know, no one's doing this in dentistry.
Right.
So it's been amazing because not only is she tapping into her creative side, but she's also dropped down to 3 days a week. She's so much happier in dentistry. I would say that having a side gig is the greatest cure for burnout because
Yeah.
it engages you in a different way and you can start to have fun again. And then it makes dentistry a little bit easier to tolerate for people who struggle.
And I think what you're doing the work of the Lord G.V. Black, Laura, because you're giving dentists a unlock to a life that they didn't know existed, and telling them it's okay to feel this way. Let's figure out together how you want to insert dentistry into your life over time. Now, when people text bees to 215-543-6454, how do people get started? Do you usually do a Zoom consult with them? Do you have them fill out a form? Somebody's watching thinking, I need to connect with Dr. Laura. I need to find out what fits in my life. What happens when they do this?
Yes, so I do offer a free consultation because we need to make sure that we're a fit for each other. We need to make sure that I have what you want and that you are a fit for me as
Yeah.
well. So it's a fun conversation, and most people feel a lot of relief just having someone to talk to
Right.
about the stress that they're experiencing and the shame and the doubt and all that stuff.
Love that. Well, if you're watching this and you feel this way, and also just like we tell our patients with periodontal disease or decay, you don't have to wait until it gets terrible to get help, right? You can just JFO, like I say, just find out about a life that you might not have known existed. I've been, me, I've been a broker. I still do that. I've started these two companies of this, and I was at my dental office on Tuesday. And right now, dentistry, the dosage I'm consuming for dentistry is perfect for me. So I really appreciate you championing a life that looks like the right one for dentists that might not be of what you thought of in dental school, Loris. Thanks so much for sharing with us today.
Thank you, Paul. And thank you also for championing me having this very unique message that we're really trying to spread in dentistry.
Awesome. Our grandmothers were right. We're very special, right? Just ask them. So thanks so much, Laura. So as you guys can see, we learn about materials. We learn about fixing your morale here on Talking Nachos. I'm ready for my next guest when they're ready to come up. Awesome. I have a fellow dentist on with me. Share with me what you do to help dentists cry less inside and a little bit about your story.
Sure. Hi, Paul. How are you? Thank you for having us at Dental Nachos. Well, I'll start with my story. I'm a dentist, general dentist. I practice full time. I have done it all. I've been an associate in a DSO before it was a DSO. Yeah, and I have two startup practices that I still own and run.
Nice.
And I also am a co-founder of a dental software company. So I guess I have a dental
Cool.
side gig.
Yes. Yeah. You have side gigs that turn into main gigs. I love that.
Yep. And, Practice by Numbers honestly was born out of my pain points when I started out my first startup, dental startup. And, as a dentist, we struggle with many different hats that we wear. And my biggest struggle was the business side of dentistry. When I
But
started
wait,
out,
Dr. Didi, I really think, how did you struggle with business? We had all those great courses in dental school about how to run a practice. Oh, yes, we had none of those. How to make a terrible bite rim, we had those. Did we ever have to make them again? No. But not once did people say, how does insurance work? How does team wages work? I think it's so irresponsible of dental schools to not even make that a awareness factor. I'm not asking them to teach dental students how to run a practice, but just to know that things like dental insurance exist. Because the cry inside feeling you guys help solve is, have you ever been working really, really hard and not sure why you're not making enough money? Because that's happened to me many times in my career. I'm sweating, I'm crying on the inside, I'm seeing patients, and at the end of the week, the day, or the month, I'm not making what I think I should be making, and I don't know why. Is that does that story
exactly.
feel authentic to you?
Exactly. You hit the nail on the head, Paul. I mean, I lived that moment in many, many, many ways. I was very frustrated. I was like, how can this be possible? Right? How am I not making as much as I thought I should be making? Where is it going? What's happening? And so Practice by Numbers really came about with all my frustrations. My husband is a software engineer, and I would be the quintessential nagging wife. I'd be like, dude, what's going on? Help me out here. And we started to then look into what was going on in my practice. We started to look at reports. And it was like trying to find a needle in a haystack. It
Right.
was crazy trying to find the numbers to see where you're lacking, what's going wrong. How can you fix what's going wrong unless you know what it is, right?
And also, I mean, I'll just add it. Sometimes it's just so confusing to keep looking at different numbers, right? If I'm like, I can do 82 jumping jacks in a minute, am I fit? I don't know, right? And then, there's just dentists to empathize with us. Sometimes we get numbers and it's just hard to analyze them. And is practice by numbers. If someone's listening to this now or watching it, you've created this with your husband to help solve your pain.
Yeah.
What does practice by numbers? If you had to put it in a few sentences, what do you guys do?
Well, to summarize what we do, because we do a ton of stuff, we help practices, we monitor, evaluate, and empower your team to use both the numeric as well as the human data that you have already existing in your practice. And this helps you, knowledge of this helps you unlock the
Yeah,
secrets to living your most balanced
I
and
love it.
productive life as a practitioner.
I absolutely love the way the unlock part and clients you've helped. We're not the easiest of people, right? We're always thinking there's a scam inside of a scam. We ask for a bite wing of the bite wing. We got so many problems, at least 99. But you've worked with clients just like you who probably thought, I don't know if this thing's going to work, but I'll try it anyway. Or I don't know, I'll sign up for this software. How has that transformed? You don't have to necessarily use their name, but how has that transformed some of your dentist customers that are just like you?
So, I'll tell you a little story. I was at a meeting just a couple months ago, and I had a dentist, not somebody I don't know, just came out of the meeting room, came to the booth. I was standing there, and he said, "Hey, are you the co-founder of PBN?" I said, "Yeah." And he's like, "I need to give you a hug." I'm like, "Oh, okay." And he gave me a big hug, and he said, "You know what? You guys are awesome." I said, "Well, thank you so much." And he said, "Yep." He said, "We went from 3 practices to 13."
Oh, wow.
And he said, "And it was you guys that enabled us to put systems in place to be able to reach our goals." And, Paul, that was the most humbling and the
That's awesome. It's
best.
amazing something you've invented has had such an amazing impact on someone that you might not have ever known if they didn't give you that hug. And I think, more people, and I try to do this with things I use, should reach out to companies that have helped them and just let them know how much they appreciate, because it really makes our day. I love getting a great review from my dental office, and I think it's just such a cool story, such a Nacho story of the always be connecting, collaborating story. So if people are listening, Dr. Eden, they're like, okay, this sounds like something I need. I use spreadsheets inside of spreadsheets. I don't even look at my reports. When they text PBN to 215-543-6454, can they do a consult with your team? Do they do a demo? How does that work?
So they usually get a demo, and you can schedule that demo using the text, or also you can go to our website, which is www.practicenumbers.com, and that will take you directly to scheduling a demo with our with our team.
Awesome. I'm a big fan of just do the demo. I mean, we're two dentists talking. Do the demo. You learn something, right? I've had my office manager do demos. Whether it's with a financial analyst, whether it's with a technology company, and even if it's not the right time to move forward, you leave those demos thinking in a different way than you did before. Get your website analyzed. See how your SEO is working. Maybe it's working great, maybe not so great. But us dentists, we get siloed into our caves, right? And we just we're not as open-minded to new ideas as we should be as both entrepreneurs and clinicians. So I love what you've shared here. Where are you guys based out of?
We are based out of Seattle, Washington.
Awesome. You got to come back to Philadelphia and see us sometime at Nacho headquarters. I so appreciate you sharing. I love that hug story, and thanks for supporting our community.
Thank you. Thank you for supporting us. Appreciate it.
Great job. So as we just continue to talk about materials, morale, and money and metrics, so many awesome topics here on Talking Nachos. I'm ready for my next guest from my team. So we're going to just let Mike introduce himself. Mike, what have you signed up to do to help dentists increase success, decrease stress, and reduce crying inside?
Yeah, so Mike Buckner, I'm Executive Vice President over at Pearl. And, a little bit of my background, I was very early on at some different dental tech companies. I'm kind of the dental tech nerd, love the technology. And when somebody said, hey, once you're in dental, you'll never leave, I thought, that's not true. And absolutely was true. So I was very early on.
You've been infected. You've been infected.
Absolutely.
I always say this, like, to my team, especially the branders. I said, I went to school to be professionally weird. You guys have voluntarily signed up to help us. Maybe you need the most help of all. Maybe you need your own Lord Brenner. The people who I work with, dentists, please help me. I say that in an awesome way, because the supporting world of who's out there helping dentists who don't have dental degrees like you is just awesome. So yeah, continue with your journey through dentistry here.
Yeah, thank you. So early on at Solution Reach, helped growing their partnership programs. I was very early on over at Dental Intelligence, and then also over at Weave. So helped grow a few of these dental tech companies. And what's been exciting is seeing this technology truly help the practices, because there comes to a point where really, in order to maximize production, profitability, and efficiency in the practice, we have to rely on technology.
Yeah.
And so I came across Pearl when I was actually consulting for a few different tech companies. And when I saw the technology, I knew that this was going to change dentistry. So what Pearl does, is, we've heard a lot about artificial intelligence, and what our artificial intelligence does, with our computer vision, we're able to take the x-rays that you're taking in your practices, 2D images. We're able to break those down pixel by pixel in real time. So as soon as you get an x-ray taken, we pull that digital image, we run it through our AI software, and then we're able to highlight all of the detections, all the pathology, everything that's going on that x-ray. And then really give the definition to it to show exactly where the caries is detected, how far into the dentin, how far into the enamel, showing periapical radiolucency, calculus, so we're showing all of these things to the team, but also showing it to the patient in a way that for the first time, they can actually see and understand what's going on these x-rays. It allows the dentist to present the data and to show them what's going on the x-ray and why we want to proceed with XYZ treatment.
I love that. I was did a great collaboration with Dr. Kyle Stanley and his sponsored course on being mentally resilient, which was great. So since he's a friend, I want to give you a free marketing tool. I think you guys should market this as an extra set of AI eyes, right? Because that's basically what it is. You can use that, maybe give me credit or not, but
AIIs. I like that.
And spell it AIYES, right? Dash YES, because what I can share with this context, and Dr. Aditi could, and Dr. Laura, when she was still practicing, was it's overwhelming the number of bite wings you have to look at.
Yeah.
And, you have associates working with you, you have hygienists, and it's just awesome to get some security of that extra set of AI eyes. And I mean, our practice is utilizing Pearl right now. My brother is enjoying working with the associates and using it. And I mean, we're having this discussion authentically. Is this something that you can use as a patient education tool and something at the end of the day to check on your notes? Or how are most dentists implementing this, in both ways? Or is your hygienist showing it to the patient?
Yeah, so there's a couple different ways, and I think it starts at the beginning of the day. So what our software is able to do is to go back and to scan the last 18 months of all of your x-rays in the practice. So we pull all of those in, we run them all through our AI software, and then we compare our findings with what's in the practice management software. So we're able to show all of the undiagnosed opportunity. We then put that into kind of like an AI generated schedule, so that when we're coming in, doing our morning huddles, and we're looking at the patients coming in, we can see highlighted on the schedule which patients have undiagnosed opportunity.
Yeah.
And that points the team in the right direction to say, okay, between 19 and 20, the patient came in 6 months ago, AI is highlighting this area here. Let's be sure we check that. So
right.
we're showing, and we're able to highlight undiagnosed opportunity. And then when the patient sees that on the x-rays, it's powerful. And in fact, we see a case acceptance increase between 25 and 30% on average, just being able to, the patient can see it, understand it, and truly it leads to case acceptance.
And I'll just share, technology is a tool, right? A CBCT is a tool. The app Waze is a tool for driving. A scanner is a tool, and this is a tool. Brandon from my team loves a good spreadsheet. Maybe he made them by hand back in the day. He's my age, and now he has Excel. And now his team member Lindsay didn't know when you had to make them by hand. And maybe there was like some quaint, I love to handcraft something. But what you shared was, without technology, dentists get exhausted. Without technology, dentists can't help as many patients. I mean, even when you use those patient engagement services you work for, I mean, they've been game changers for me. I'm old enough to where my team had to make 47 confirmation phone calls in a day, which was just a total waste of time, right? But it was all we had there. So now with Pearl, you're able to implement this. And, I think the wow factor of stuff for patients is important. I think we like the wow factor. I mean, you go to a Mexican restaurant, they make the guac table side, right? It's very wow factor. I never know why, but I'm always kind of wowed by it, right? They could make it in the back, but it's a bit of a wow factor. And these wow factors increase patient confidence. I don't know if you would agree with that, or you've seen that with your clients.
Absolutely. In fact, for me, where this really hit home was, my wife's a breast cancer survivor. She's doing well. We just finished her last set of surgeries. But a year ago, Paul, when we went in to go to the oncologist and we got the mammograms, the oncologist missed it. We're looking at black and white images. We're looking at black and white pixels. The oncologist missed it. So we did an ultrasound. They missed it. They said, there's something there, but it's not typical to what we see. And then he said, let's watch it. And I thought, there's no way we're watching it. So after a biopsy, it came back positive. And that's when it really hit me that we have this technology. We have the ability to have artificial intelligence act as that second set of AI eyes.
Yeah,
right?
I want to use that. The Dr.
I love it. I love
AI
it.
eyes, because I think everybody wants that extra set of eyes as dentists for so many reasons. You want it on your bookkeeping, you want it on your daily reports, and now that you can have it on your x-rays, it's a true game changer. So now with implementing technology, it's fair. Dentists can get overwhelmed. They got to get a scanner, they got a CBCT, they got to do this. So now, if this is a new thing to dentists, when they text Pearl to this number, 215-543-6454, what happens? Do they do a demo with your team? Do you jump on Zoom with them? What happens?
Yep. So we can schedule a Zoom meeting. Most of the time we can do this during a lunch break or when it's convenient. Does not take that long. I mean, our software is really designed to be very intuitive. So we can meet with you over lunch, 20, 25 minutes, depending on questions, walk you through and kind of show you how the AI will assist, and also just help save time. It brings the team all together on the same page, especially as you have associates. It just helps everyone see what's going on in the mouth. The human eye, we have limitations, and this is gonna be able to really enhance day to day, but also show your patients, what you're doing that is keeping you cutting edge,
Right.
amongst all the other dentists out there.
Absolutely, Mike. Thanks so much for supporting us as a sponsor. Love using this in our practice. My brother's really enjoying it. And thanks so much for being here today.
Awesome. Thank you.
Thanks, Mike. So as you guys see, we talk about everything here. Just talked about technology to make your life easier, improve patient care. I'm ready for my next guest when my teams are ready to bring them up. Awesome. So I have here, share with us what you do to help dentists increase their success and most of all, make sure they are not crying inside.
Well, Paul, it's nice to meet you. I'm Roger Roundy with DentalFi. DentalFi
Awesome.
is a financial firm specializing in helping dentists cry less due to numerous factors that cause them to cry. And so I totally appreciate the opportunity because this is fun. Listening to the different reasons that make dentists cry
Yeah.
makes me think about, how much I love what I do.
I also want to share,
Because
Roger, I'm going to share two things. First of all, I don't know why we need to have this interview because one thing at dental school, they went over how to deal with money, how to retire. We had so many courses. We can just end there. Right? Just kidding. They also didn't talk about that at all. I mean, they didn't talk about how you could go from $500,000 in debt to making $250,000 in 3 years and how that's really overwhelming. So it is totally on brand to have someone like you helping us. But I wanted to pause for a second because my team has said this, and someone was saying this at our meeting the other day. When you see all these things dentists have to go through, you didn't always know this as a patient, right? You didn't always know this when the dentist came and checked your teeth. To give you a little empathy and compassion for what we have to do.
Well, it is interesting. And just so you know, I do have $1 million smile that cost me about $6,000 right now. So
Nice.
just finished my work. So I'm super excited.
Thanks for supporting us. So
Yeah,
back
right.
to what you guys are doing in the cry less inside world. How are you helping dentists daily do that?
Well, it comes back to really who I am and what I represent. I love my country. I live in a little town called Providence, Utah. I fly a flag out front of my house. I love our country. I think that all of us who live in this country, because of the opportunity that we have, should all pay in much in taxes as we're obligated to, but not a penny more.
Gotcha.
So me personally, my career is based on helping successful entrepreneurs, dentists, those who are making more money, keep more of that money through advanced tax mitigation solutions. So part of DentalFi is a tax mitigation firm. So that's what I do personally. I really think that if we can keep more money in our clients' pockets, they're going to be better at spending it than the government is. Obviously, these things are appropriate for when we mitigate our taxes. It must be done ethically, morally, and within the intent of the code. But if I can help a dentist or a successful business owner keep more of that money, put it to work, that's really part of DentalFi solutions. These are advanced tax mitigation solutions, and ultimately, there's basically 4 types of income.
I love that. I mean, one of the things, as I've learned throughout my 2-decade journey through dentistry, is that taxes can be as confusing as dental treatment plans. Remember, 4 out of 5 dentists recommend Trident. They couldn't get that 5th dentist to recommend Trident. So I know, I mean, your world, it's really become pretty dramatic over the past few years between the PPP, the EIDL, the things like that. And I think, is it normal for a dentist to be confused by taxes, right? Should we feel stupid because we're confused, or is it normal to feel confused by taxes?
Well, there's 77,000 pages in the tax code, so even most CPAs are super confused. And not just to clarify specifically, I'm not a tax preparer, right? That's your CPA. I am a tax planner. So I work with the clients prior to the end of the season, end of the year. That's why right now I'm currently sitting in Key West, Florida, preparing, because the next 2 months of my life are super, super busy, because that's when tax planning needs to happen. Okay. So, but it is super confusing. And when you look at your income, all of a sudden you've gone from, student debt, you've been working hard, all of a sudden now you're successful. And what do I do to keep more of this money? Right. But here's a question for you, Paul, specifically, Paul. If there was a way in which you could morally, ethically, and responsibly keep more of your tax income, when would you like to know about that?
I would like to know about it now. I mean, we handcraft. One thing about dentistry, we're handcrafting our work on people. And, you know, when you look at, I think people sometimes unfairly judge dentists as these rich people with a bunch of boats, right? Even though I have no friends, we have a low boat factor in my friend group, but everyone's like, how many boats do you have? People also will say, I did a $1,500 crown that must have paid for your car. And I go, what car are you buying for that? So we really do get bombarded with this financial stress. And it would be great if there was a way for us to make more. What clients, like, you know, this must be a real aha factor for people that you've worked with. Give me one of these stories where you have aha-fied someone and now they are much happier after
Much
crossing
happier.
paths.
Well, when you look at who the audience is right now, right, you basically have 4 categories. You have those who own their practice. You have those who work for a DSO and they're a W-2 employee. You have those who are looking to sell their practice. All those 3 types of incomes have different tax liabilities to them and different ways in which we can help a client mitigate their taxes. So if you own your own practice and you'd like to save money on your income every year, your ordinary income, well, we might use an 831B. So for example, I've got an orthodontist friend that's been a client of mine for a few years, and every year we cut his tax liability in half utilizing section 831B of the tax code, and where we help the business owner create their own dental warranty, and they're able to take some of their gross revenue and pay it as insurance premium. So that's one of the ways in which we can limit or lower their tax liabilities, is through business deductions, right? If you're a W-2, you know, a lot of guys will sell their practice and work for a DSO. That's great, and they become a W-2 employee. Well, if they're making $400,000 or $500,000 a year and as a W-2, they're getting absolutely slaughtered in taxes, right? There's ways in which we can help them mitigate their W-2 income. My favorite is, you know, just got off the phone with him earlier today. A successful orthodontist in Utah just sold his practice for $4 million.
Wow.
He's about to pay, or would have about to pay, about $1.5 million in taxes on that sale. We've cut that tax liability down by about $1.2 million.
Wow.
So he's only going to pay about $300,000 in taxes on the sale of his practice. That's the type of value that we can provide. So really what happens, our process is pretty simple. We ask the client simply, how's your practice doing? Are you going to get killed in taxes?
And then just because I like to motivate people to move forward, Roger, when people text in or do something, they can text Dentalfi to 215-543-6454. We'll share how to connect. What's the first step? Do they do a consult with you and your team? Do they send you their K1s? See, I can talk your language. They send the K1s, or, you know, so what do you do to get someone started? If someone's listening in my world right now, live or on demand, saying, hey, this sounds like me. I'm about to sell my practice. I am a W-2 employee and I feel like I'm paying too much. I'm a practice owner that's struggling. What's the first step?
First step is, let's have a consult. Let's talk about where your income's coming from. We'll diagnose the problem, right? We're going to find the cavity, and then we're going to prescribe how we're going to fill that cavity. And ultimately we'll tap into the tax mitigation enchilada and figure out which of the solutions will be appropriate for the problem. So it's just an initial phone call, 10, 15 minutes, or when you get onto our website, you'll be able to filter out, you know, we have a filtration system where you'll put your information in. It'll kick out who's going to help you based on the income that you have. So initially it's just reaching out to us via either a phone call or getting onto our website. Let's diagnose the problem, just like you guys do. Then we'll prescribe the fix. So a simple conversation.
I absolutely love that. And, you know, to inspire you as one of our newest sponsors here, please educate our community. Everyone on this call, everyone who's been on this show, educate our community. Educate them, share what they should watch out for, share some of the wonderful things that happen. Dentistry is an incredibly lonely profession, even when you're surrounded by people. And it's awesome to have people like you on our side. Thanks so much for sharing with us, Roger.
Appreciate your time. So it's great to be here.
So in less than 40 minutes, we have shared with you, my team can bring up the Smithson code, how you can increase success, decrease stress, and reduce crying inside. Please come and high or low five us in Philadelphia in April of 2024. Text Smithson to 215-543-6454.